Hello there, this is Rom Wills coming back at you with a special video, and we have a special guest today. Today's topic is the impact of mental health on relationships. And our special guest today is Mr. Perry Jenkins. Perry, why don't you tell them about yourself and what you bring to the table?
All right. Well, first of all, I appreciate you having me here today. My name is Perry Jenkins. I'm a psychiatric mental health nurse practitioner, which basically means that, I have a focus with psychiatry, with medication management. I currently have a private practice where I treat patients with issues ranging from, schizophrenia. We treat anxiety disorders, post-traumatic stress disorders, things of that nature. So that's just kind of a brief overview of some of the things that we do, providing medication management as well as therapeutic services.
Okay. All right. Now, one of the reasons I wanted to have you on because I believe you responded to a video I did a few weeks ago talking about mental health and the mental health issues in the community in particular, but just in general in relationships. Because one of the things I found when I'm doing consultations, there's been plenty of time I'll say to the person I'm talking with, okay, we're going a little bit further than what I can advise you on. Yeah, I can talk about game and hitting the body and putting on some nice clothes, cologne, and all of that. But the reality is in relationships, male female relationships period, there are a lot of mental health issues. That's beyond my expertise to really talk about that. So I wanted to bring somebody on who could talk about it. Now, in your practice with regard to relationships, what kind of issues have you seen in particular? I mean, we could probably go a couple hours talking about everything and
Right.
still have to do more. What have you seen in particular?
Well, I mean, it can range from things with folks that are suffering with substance abuse issues. And naturally, if there's issues with substance abuse that can impact and have an impact on the relationship, not only the individual, but also, if they're married, if there's children involved, the dynamic of what's going on can also impact them as well. So, not only do we end up treating for the substance use disorder, if we're using that as an example, not only are we trying to treat the individual for that issue, but we also have to treat the family members as well, because everybody else is impacted by that. That can also range from things like post-traumatic stress disorder. Being a military veteran myself, I also am aware of the effects of post-traumatic stress disorder and how those types of things can impact the family and the family structure. And so, these are also things that we can treat as well. So I don't know if hopefully that helped to answer the question in regards to, some of these issues in psychiatry that can also negatively impact the family structure if
Well,
left.
okay, well, that's a very important thing because one of the things I have seen as a layman, as far as the mental health side,
Mhm.
is many people's relationship experiences are the formulation of them had been during their childhood. So whatever they saw as children coming up, they tend to look for similar experiences. If you can speak on that a bit more, because you're the expert on this, I'm not. I can say from a general outside looking at it, but you've seen it up close because I was surprised when you said substance abuse and the effect on the family. I'm
Mhm.
thinking some other things. That's why I wanted to bring a gentleman such as yourself in here, an expert. So if you can tell me what you've seen as far as that, more on the family issues coming up.
Right. And so as I was mentioning that, how we have to treat the entire family, it can impact the children as well. And if there are issues such as trauma, things of that nature that may have also taken place, it is it I understand what you're saying as far as there are some people that when they've been in that type of predicament or they've experienced that type of situation where, they may seek out similar instances. And that's what tends to happen without treatment. And so that's another reason why it is so important to look at getting some form of treatment, whether it be through therapy or whether that be through medication management to address any symptoms that may be present. And, symptoms can range from things such as, anxiety disorders, panic attacks, nightmares, things of that nature. And if left unchecked, it can cause issues with the workplace, if it's impacting your, and well, let me back up a little bit. So it's natural for all of us to actually experience, levels of anxiety or depression. That's not abnormal. The problem is where it becomes an issue, or where we look at it as becoming clinical, is when it begins to actually interfere with life, whether it interferes with your family structure, when it begins to interfere with your work life, interpersonal relationships. That's when we start looking at, well, what do we need to do to start, trying to treat these symptoms because they are beyond the ability to control them, personally.
Okay, because it's interesting. I was going to bring up something about anxiety because I hear many young men and women, especially when they're talking about relationships, talk about social anxiety. Social anxiety. They might be just afraid to, for whatever reason, to talk with someone of the opposite sex or potential partner. And from a personal point of view, I can't relate to that, but that doesn't mean it doesn't exist. It's very legitimate. How
Right.
have you dealt with people who may come to you with social anxieties?
Well, there's a few different ways that I approach it. My focus is primarily medication management. And so that's what my area of expertise is. A lot of times I will first recommend therapy. And therapy is generally the route that I like to recommend because it doesn't require medications. Usually, they start discussing things like coping skills. There may be breathing techniques, or other forms of therapy, such as phototherapy, which is where they may change the colors of the light bulbs in the room to create a different ambiance so that people feel calmer and things of that nature. There's aromatherapy. There's a lot of other ways in which some of those symptoms can be addressed, or at least controlled to the point that it's not interfering with daily life. So usually I recommend therapeutic techniques, but sometimes even with those interventions, the symptoms still aren't fully controlled. So that's where medication may come in, and that's when we start discussing things like SSRIs or SSNRIs, different types of antidepressants slash anxiolytics, things of that nature. That's more of where, with my field, my area, where we may begin to discuss medication management in the event that we can't seem to get those symptoms under control independently of medication.
I understand. I understand. I mean, definitely whatever is needed because, well, here's a just an overall question. And
Mhm.
just, I mean, you see what's happening just overall with relationships, just period. One of the things I've said is I think we need to get more mental health professionals involved in even speaking on relationships. It's one thing for a writer to speak on it or someone who calls himself a coach to speak on it, but there's a lot of stuff when it gets deeper. We do need the professionals. What are you seeing? I mean, when they I mean, like if people come into you saying, well, I'm having trouble, this is causing trouble in my marriage or causing trouble in my relationships, or my mate cheated or I'm cheating because I'm this is what I'm feeling. What has been your experience with that you can share? I understand everything is confidential ultimately, but
Right, right, right. Well, in my experience, a lot of times where they do begin to seek help is that they've hit rock bottom, and it's unfortunate that it takes that sort of an incident to occur where maybe there was police involvement, or maybe it's court ordered. Now that's not always the case, but for a lot of people, it's not until maybe they're on the verge of a divorce or something of that nature where it was an ultimatum was brought forth. Hey, you need to either seek some help or I'm leaving. And so under those circumstances oftentimes is where we meet them. And so uh what I appreciate is that getting this information out, hopefully people will look forward to they'll look forward and try to seek treatment before they reach that rock bottom place. So when they start noticing certain symptoms or start recognizing certain things that, the earlier we can intervene, the better the outcome typically is going to be. And so that's generally what I've been seeing in terms of how that's impacted relationships. Or it could be also that they're on the verge of losing their job, or maybe they've lost their job as a result of symptoms that they've been experiencing. One of the things is talking about like bipolar disorder, for instance. Where a person may experience mood changes. They may experience periods of lows, as well as periods of what we call mania. And that could be irritability, aggression, impulsivity. These are some of the symptoms that are experienced. And some people, instead of seeking treatment, they may self-medicate, or they may just allow those symptoms to play out. And usually when it starts to cause problems, either at work or at home, that's when they begin to seek treatment.
Now that's interesting because one of the things I'm seeing, and I want to get more into the Black community,
Mhm.
particularly with Black men. Are you seeing what are you seeing there as far as mental health and relationships? I mean, we could talk about mental health and a whole lot of other things with everything going on, but as far
Right.
as how Black men in particular, I know, yes, I got other groups who watch this channel,
Mhm.
but there seems to be a lot with what's going on with Black men that's not being addressed as far as mental health. Just overall, I mean, we can focus just on relationships and how we're relating to everyone right now in in your comments, but I know we could do a whole series on this and bring in other professionals, a panel to even discuss this.
Right.
But what I mean, just your from your point of view, what do you see? What concerns do you think need to be addressed? Just
Well,
whatever you need to share. This is very important.
right. Well, specifically about, Black men, I think, you know, a lot of times based upon our backgrounds, we may come from, we're more prone to issues of depression. We're more prone to issues of anxiety and some of these substance abuse issues. Oftentimes due to poverty, due to the conditions in where we live, racism, there's a lot of these types of things that also impact, the Black community. And so one of the other things that I notice about our community is that it is typically a subject matter that we don't discuss amongst ourselves. I think all of us, we've got a family member, we've got that uncle, we go to the family reunion. We know that there's, something going on with them, but we don't talk about it, or we may not discuss getting help. And so I think that, it's a subject matter that I believe is important that, we actually get out and we talk about it. But amongst Black men, amongst, our population, it is a subject matter that, as I said, I don't feel as though we take enough time to sit down and talk about some of these problems that are going on. And, instead we tend to sweep it under the rug, or as men, we're kind of expected to carry the load to deal with it. And so, I think that we have to find a way of breaking that particular barrier, so that we can be a little more candid and open about what it is that we're experiencing, so that we can avoid, some of the deeper problems that go when things such as depression continue to go on for an extended period of time, that also increase our rates of suicide and other issues like that as well. So that's what I would say in terms of what I've seen um, amongst our population.
Well, I mean, and that's and that's one of the reasons I wanted to have gentlemen such as yourself on here because you know how we do on here. We
Mhm.
jump on each other and say this and that and clown, but out of here in the real world, we got to deal with these things. So I mean, initial recommendations. If okay, someone listening, they know they're going through something. Sometimes they'll call me up, get a consultation. They'll say some stuff, and then I'm like, okay, you need to talk to a professional. What initial steps that like if you're talking with someone listening and
Mhm.
they are feeling maybe a depression, anxiety, what initial steps would you say they need to take to address it? I mean,
Right.
it's obvious to say go talk with somebody, but what recommendations would you give them to like really even just recognize what's going on with them?
Right. So, depending on the severity of the symptoms that they're experiencing, oftentimes they can make an appointment, with their local outpatient clinic, to schedule an appointment to be seen for these issues. But if we're talking about issues such as having suicidal thoughts or, these types of issues, typically we'll recommend that they go to the emergency room to get an evaluation, or most places have a crisis line. Depending on where you live, you can look that up online and find crisis intervention. And a lot of times they'll come to where you are and actually give you an evaluation and decide at that point, what steps are necessary, whether it's something that they need to intervene immediately, or if it's something that they can schedule an appointment for you later to be treated for those symptoms. So that's what I would recommend, depending on the severity of what's going on.
Oh, okay, okay. Now, I don't know. I mean, this is the thing. It's so much. It's so much. One note I had written down about personality disorders. You had
Mm.
mentioned stuff with substance abuse. What other personality disorders have you seen that has a profound impact on interpersonal relationships?
Um, I would say there's a lot about those when you're talking about borderline personality disorders, narcissistic personality disorders, where there's no compassion, there's no remorse, for some of the things that are going on. And the list goes on. I don't have the full set of the list of everything that it includes. Um, but those particular types of disorders I've noticed um, tend to cause a lot of problems with interpersonal relationships, with being able to build long lasting relationships. And so, in those types of cases, it's not typically treated with medication. Those are the types of cases that are generally treated with therapeutic services, what they call CBT or cognitive behavioral therapy. Those are some of the interventions that are required. Should you be diagnosed with something like a personality disorder, that's not something. The other thing about personality disorders is it's not something that you'll generally pick up in a first appointment or two. This is something that you get after spending considerable time, with the client, or it can be diagnosed with a psychologist, where they can do a psychological assessment. That's where those types of disorders are generally picked up and worked on.
Okay, one question I had about the disorders, because okay, you mentioned a narcissistic disorder. One thing I've seen, a lot of times people throw a lot of these around just because they don't like somebody, or say, oh, they narcissistic or something.
Right.
From a personal point of view, I think that's a problem, just willy-nilly throwing it around without really knowing what's going on, because a lot of the times people who have some, that's a serious thing that could seriously affect the person if they have it. And it's almost like people, it's just, oh, they're narcissistic, oh, they're borderline. And that's a real issue right there, because you know what happens when you have somebody who actually has those things. They
Right.
might not want to talk about it. I mean, have you seen a lot, notice that yourself, just overall, not even in your practice, but just overall, people just randomly throwing around these things?
Absolutely. A lot of times people don't really understand what those terms truly mean, and they are oftentimes misused, and folks are mislabeled with some of these types of things. I mean, I've also heard the term bipolar thrown around a lot as well. Someone will call someone bipolar if they think that they don't approve of their action, and so it really isn't. Um, the way that those terms are being utilized is not consistent with what the true definitions of those terms actually mean. And so, another thing is that I kind of encourage people, if they want to understand more about this, there's a lot of resources, there's a lot of information that actually will show you what it means to have those symptoms, and show you a list of the types of symptomologies that's required in order for you to actually be diagnosed with something like that. So yeah, it is, and I think that it adds to the negative stigma that is associated with mental health. is that when those types of terms are just kind of thrown around in that manner, I think, and used in those negative connotation, I think it also presents as a barrier to treatment.
I'm glad you said that because I actually wrote that down. I was about to talk to you about that because that is a big issue. Yes, we're talking about overall, but particularly in the Black community, you
Mhm.
know, somebody say, hey, you have those issues, and it seems to be something against getting that help. Get just talking with somebody, even if it's a counselor, something, a spiritual leader. There is a negative stigma, and it's like so there are so many people suffering, and then this is having an impact just overall. As you outline many of the things, just Black men in particular go over, but this is the entire Black community. This is the entire world community, really. Everybody's going through it, but particularly within the Black community, there is indeed a negative stigma about that. But these are real issues because, particularly, okay, like in a family situation,
Mhm.
if the father or something like that has an issue, that's affecting the rest of the family.
Absolutely.
And I mean, what are your thoughts on that? Just really addressing those issues as a community overall, like recommendations, your thoughts, whatever you have to say on that.
Yeah, as a community, I think educating ourselves about what it means to have issues regarding mental health. And as a nurse, educating is one of the most important things, one of the most important pieces of what it is that we do. Is we want the population to have the information necessary so that they can make an informed decision on how to move forward. And so, I think the first thing is to get this information out and, let people know that, there is help. There are things that we can do about this. And there are ways in which we can have these symptoms treated that it doesn't negatively or doesn't have to continue to negatively impact the family structure. And so, that's what I think is most important is that we educate ourselves and that we put the information out there that folks know where to go in the event that that either themselves or someone that they love and care for is also experiencing it, because they also will be able to recognize what some of those symptoms look like. So that's what I think is most important to put out.
And I agree with. I definitely agree with you. How much? And this is, I'm gonna say, particularly within the Black community, how much of an impact affecting how we're treating mental health is based on the overall culture that we have. The overall culture. Of course, there's plenty of subcultures, but overall culture of like being cool all the time. They used to call it having a cool pose, acting like nothing's a problem. How much do you think the overall culture is really preventing us from really dealing with these issues?
I know it definitely plays a part. As stated earlier, I think we have this perception, especially as Black men, that we have to be able to carry the weight of whatever it is that's going on, and we're taught typically pretty young not to show a lot of emotion, to be strong, you know. If you fall off your bike and you scrape your knee, a lot of times, as a young boy, they'll tell you, hey, pick yourself up, stop crying, don't show, don't. And so these kinds of things, which I understand the purpose of it, but we have to make sure that it's balanced, because we do need strong men, strong Black men, but at the same time, we also need to make sure that they know that if there is a problem that's beyond what they're capable of dealing with or addressing, that there's no shame in seeking help and reaching out for help if it's needed. So, yes, I do believe that it does play a bit of a role, but I do think that we also have some solutions in which we can address it if we approach it in the manner that I just described.
Okay. Well, about winding up and stuff, but just a few more things. Do you take clients now? And would you be interested in having clients maybe on distance on Zoom or anything?
Yes, I do work with clients now. It kind of depends, what state they're in, because with the way you practice is, some cases you might not be able to practice across certain state lines. And so that kind of depends. But, I do see clients, through telephonically or telemedicine, through something like Zoom, where I'll interview them and also, give recommendations and things of that nature. So it's already a part of the practice, especially in the current environment with COVID. I had to, kind of step back for a moment, and I couldn't see as many patients face to face until, I went forward and received vaccinations and things of that nature. But that is something that I am interested in continuing to grow my practice.
If you wanted to share your email or contact information, feel free to do so.
Okay, well, I can be reached at gvbhealth. That's for Greater Visions Behavioral Health at gmail.com.
Say that again. What is that again?
gvbhealth
Okay.
at gmail.com.
Okay. All right. I'll put that in the description box. And they would just ask for you, or that goes directly to you?
Yes, that'll go directly to my email.
Okay. So that's gvbhealth@gmail.com. Okay. Okay. That'll be in the description box because, it really is it's a serious matter. It's a serious matter. And this is just a brief introduction, just to put the thought out there. Hey, we need to deal with this. We really need to talk about this. There was I can't give this particular, it's a famous psychologist. I can't give his name because if I give his name, trust me, all the focus will be on him. Then they'll forget everything you said. But I was trying to contact him, but not for this, but it was before, because I always saw the mental health aspect. I mean, it makes a big difference. If like I've seen families, like you said, I've seen families where, you might have the mother or father doing a whole bunch of unproductive things,
Mhm.
and you already saw that they had mental health issues that weren't being dealt with.
Right,
Or how we do in the community sometimes, we'll just say, oh yeah, that's just my crazy uncle or something.
right,
But it's like, wait, that's a serious issue. We can't make light of that.
correct.
Because a lot of times, I think, especially within the Black community, we've learned how to deal with it, or we had concerns about the greater community and what would happen. And, we've had relatives or something who might have been in mental institutions or things of that nature. I can say I experienced that personally. So there's a lot of stigma, but we have to deal with it because it's causing chaos. If somebody's having something, if they get the treatment from professionals such as yourself, it can limit the danger. It can help people. It's very much needed. And I would say, as we discuss relationships on a more serious level,
Mhm.
not the stuff we discuss usually on here, but on a more serious level, when you get out in the world and everything, I
Right,
honestly think we need more mental health professionals in the conversation.
right,
We need the therapists, we need the psychiatrists, the psychologists, because I definitely see them after the relationships. There's plenty of therapists out there. They seeing, especially women after the relationships. I've known some men who've gotten therapy, just some, but it's mostly women. I'll give that to them. But a lot of men need to deal with that. A lot of men are carrying around stuff. Um,
right. And that's why, I thoroughly appreciated, some of the things that you were talking about when discussing seeking therapy. And I think that was one of the reasons why I reached out. I said, thank you, thank you for saying that, because there's not enough of us talking about this type of issue. And so, to hear that you were, encouraging Black men, Black women to seek therapy, to seek mental health, to receive that type of treatment for the betterment of your family. I just wanted to, thank you for saying that and putting that information out on your platform.
Well, I had to because, yeah, I can joke around and everything like that, but my ultimate goal is for men and women to be in productive relationships,
Right.
or what, so whatever they consider productive anyway. just productive, strong, but we got to deal with these issues. It's more than just how much money somebody making or even how built their body is. We got to deal with the mental health aspect. That is very key. And indeed, I would even say, just from my point of view, people need to deal with that first. Don't worry about the other stuff. Deal with that first, because you have, even with people who have money and look like they have everything, they'll have some issues that'll pop up at the weirdest time, and that we can't have that.
Right.
So any final words from you, the professional in this, that you want to leave our audience with?
The only other thing that I would say is to kind of reiterate the point of, seeking help when you notice that you're experiencing any kind of distress, especially with what's going on right now. We're still under the pandemic. A lot of people have been shut in, for an extended period of time. They may be experiencing additional issues and symptoms.
Mm,
Um, and so, some families are having to spend more time closer together than they ever have before, which may also be causing some issues within the family relationship. And so, if you're noticing that you're having these issues, also issues of domestic violence, we won't get into all of that right now. That's probably a whole nother bit of information. But that is another piece of all of that, is people are spending more time in close proximity with one another. That kind of raises the incidences of those types of things happening. So, if there are issues with, as we mentioned before, with anxiety, depression, if you're feeling suicidal or any of these kinds of symptoms that you're experiencing, it's okay to seek mental help. Talk with your local provider. Go to the emergency room if the symptoms are severe. Reach out to the crisis line in your area if you notice that you're experiencing a mental health crisis. That's what I'd like to say.
all right. All right. Well, I want to thank you for joining, taking time out of your busy day to share this. If you can just give them your contact information one more time.
Yes, my email address, I can be reached at gvbhealth at gmail.com. So if anybody has any questions that I might be able to answer for them, that's where they could reach me. But I also want to thank you for having me here and allowing me the opportunity to speak on this very important issue within our community.
Thank you. Thank you. And I want to thank you once again for taking time out. So that's it for today, everyone. If anyone needs to talk with this young man, definitely reach out to him. So I want to thank everybody, and peace and blessings, everyone.